long-term care waiver program. And Walt, did I see a hand up? I thought,
Um, I, I have not seen it.
okay, I thought I saw a hand and then it looked like it disappeared.
If
There was. I apologize. This is Dr. Womack. There was a hand just a moment ago, so I want to make sure we don't miss that person if
okay,
they.
if the person who had the hand up can unmute and ask their question or put their question in the chat.
So my question is, I'm David Gutierrez from DCBS. Do you have to go first to the acute brain injury waiver, or if you've had some rehab, are you able to transition to the long care, assuming you meet those qualifications?
Yes, you do not have to be in the acute first. There is the possibility of going to the long-term care. It really is all about, the individual, how long ago it was when they had their brain injury, what services have they had, how are they kind of at the baseline? And so there's several different factors, but you don't have to go through the acute to get the long-term care waiver.
Thank you.
You're welcome.
And I think there was one question in the chat that we might have missed. It was from Katie Johnson. She asked, "Does the HCB waiver only apply for those in need of a nursing facility?"
So if you're referring to the nursing facility level of care, that is what um, that waiver is looked at based on needs. So you would have to meet that criteria. Not saying that you have to go live in a nursing facility or anything like that, but it is that criteria that you have to meet in order to receive the home and community-based waiver.
And Alicia, we have a question from Amy, and the question is, do you know if a parent is being paid to provide waiver services to their children if that income impacts the child's SSI benefits?
So that is one thing that would not be my area of expertise. We have a lot of different individuals that are involved when the financial eligibility is looked at. So, Walt, I don't know. I don't think we discussed about the questions being captured, but if somebody could kind of mark that down for me, definitely we can take that back and I can send that to the team who are subject matter experts and get an answer back out to you if we could share that with this group.
We can do that, Alicia. I can get you a transcript of that.
Thank you so much.
Do we go ahead?
We have a question from Becca. Would a stroke be considered age related for ABI LTC if not related to substance use?
So we would need to look at that case by case. Strokes, if they are something that can be taken care of with like nursing facility rehab, then that is one of the exclusions in the ABI waiver applications. But that would be a case by case that we would have to see, what's happened to the individual, right? Where are they at? And then what do those needs look like in order to make the correct determination, whether they would meet for the ABI waiver program?
We have a question from Stacy. Would an individual who lives in a personal care home but also has the ABI TBI, would they not fit criteria for the waiver until their LLC increased to nursing facility?
So it depends on what type of supports they need. So if they do not meet nursing facility level of care, then they would not be able to be enrolled into our program. And that's about as specific as I can get. Obviously our cases are looked at, but sometimes, people are in personal assistance homes, but it's, depending on, because we don't pay for that, right? So I don't want to give specifics because I don't know what their situation is and their payment status and all of that. But in order to be in the ABI waiver program, they would have to meet the criteria within our regulations for nursing facilities.
Thank you. We have a question from Andrea. Does respite care exist for disabled individuals under the age of 18 in the state of Kentucky?
So I would like to bypass that question if we could, because we're going to get into some services and I'm actually going to talk a little bit about respite, if that's okay.
Sure. Sure.
All right. Well, if no other questions have come in, I will go ahead and move along to our HCB waiver and our
We-
Model 2 waiver. Oh,
Excuse me, Alicia, but we do have a question from Deborah about the Michelle P. waiver.
okay.
I am needing information on how to go about signing my son up for waivers, specifically the Michelle P.
Okay, I'm actually going to be sharing that a little bit later in the presentation as well. If we could just put a pause on that one.
Okay. We have a question from David. Are there any trainings, videos, or YouTube tutorials available on or using Kentucky Connect for first-time applicants to use?
What I can do is Connect is not one, that's not my system per se, but I believe there is a lot of materials out there that we could take back and get that information if you're wanting to use that yourself in order to sign you or your family member up for financial eligibility and or waivers.
We do not have any other questions at the moment.
Okay, great. Thank you. So next, our HCB waiver, individuals are going to be either 65 years and older, or they may have a physical disability. For our individuals in home and community-based waivers, they must also meet nursing facility level of care. Our Model 2 waiver is the waiver that is really the only waiver that is going to cover medical services. And this is for individuals who are ventilator dependent, at least 12 or more hours a day, or with the caveat there, they may be on an active physician monitored weaning program. And these individuals also would meet nursing facility level of care. Our next two that we'll talk about are intellectual and developmental disability waivers. And the first one is our Michelle P. waiver. So in this waiver, you either have to meet nursing facility or the ICF level of care. And then the SEL, you have to also have an intellectual or developmental disability, and you would have to meet ICF level of care for this waiver. So there are several different waiver services that are offered here in Kentucky, and our services do vary by waiver. And this list is not an all-inclusive list by any means, but we kind of picked out some that we see that are utilized. And so first and foremost is goods and services. Now, one thing I will say about this is anything covered through state plan. So any service, any item, so under our medical supplies, medical supplies, equipment, and appliances. It used to be called DME, but it was recently renamed. So anything that is covered through the Medicaid state plan would not be covered through our waivers because we only have like a certain amount of money that we can spend, right? And whereas our state plan services, they're open to anybody and everybody. So for goods and services, if you're looking for like briefs, chucks, wipes, gloves, that's going to go through the state plan side. Over the last few years, we were able to add those items to that fee schedule. But we do cover things, if they meet the criteria within the regulation and are not covered through state plan, we do cover goods and services. There are environmental and minor home modifications that we can do. I think somebody was asked about respite earlier, and this is one that I like to talk about because I think that respite is so, so important. Sometimes we do have parents as caregivers, and although they might be providing services to their child, a lot of times after that time is up, they don't get to go home and leave, right? It's really a 24-hour, 7-day-a-week job. So I always tell people that if you are one of those parents, then I really, really encourage you to utilize respite. It's very important in order for you to take care of your family, is that you take care of yourself first, physically, your emotional well-being, all of that. So respite is available in our waivers, and I really like for individuals to utilize that when they can. We do have personal care and homemaking in our waivers. We have adult day health care. So those individuals who might have some medical needs can go to an ADHC, is what we call it. We do have adult day training. There is counseling and behavioral services in some of our waivers. We also have residential services in a few of our waivers. That's going to be like our supports for community living waiver and our acquired brain injury waivers. Supported employment is another service that I believe is underutilized. And, there's people want to get out and work, right? They want to go out, be part of society and contribute. And so there is the option. We have great staff within BHDID that I work with, but through Voc Rehab and our supported employment, that is a service for individuals. And then I mentioned earlier, our skilled services are only available in our Model Waiver 2 program. And then, like I said, this is not a full all-inclusive list, but we do have a link here that if you wanted to go look at all the services available through all the waivers, you can do so there. And it's important that we understand that waiver participants have access to all services that is offered through our Kentucky Medicaid state plan.
We have a question from Sydney, and the question is related to that second bullet point on the screen. For minor home modifications, does that include ramps?
So there is, it may include some ramps. One thing that we cannot do is we cannot increase the square footage of housing. We can modify bathrooms, stuff like that, but nothing that would increase the square footage. And then, what I would do is I would definitely look to make sure that that service is available in the waiver and that it meets those waiver definitions, since this is a very high level slide.
Jennifer asks, where can I find the home modification information?
So our services, so we have a list of services that the link is here. And then also all of our services are listed in the waiver regulations and waiver applications. And before we end today, I will go through and provide some links and also get on our website and kind of show you all where the information is located so that it's easy for you to find.
We have a question from Gail, and the question is, if a client has surgery and needs more than 45 hours a week covered, are there any resources available for that situation?
So I believe that you're probably referring to the home and community-based waiver program itself. And so our waivers do have a certain amount of services. We cannot go over that, but it's possible, depending on the situation, you could look at private duty nursing to help fill some gaps, possibly along with home health. That is another Medicaid option that is available that possibly could do some wraparound services.
We have a question from Maya. Would an individual be able to have multiple caregivers in order to ensure 24/7 care?
So our waivers are not intended to provide 24 hours, 7 days a week care, unless like I said earlier, we do have some residential services that would be the case. They're paid per diem, so it's a per day. But we do have limits in our waivers on the types and the amount of services that can be provided.
We have a question from Mary. With a home and community-based waiver, can a PDS caregiver take a client to church, visit friends, go on a picnic, go to the post office, play games with the client, or senior chair yoga, etc.?
So each person-centered plan should be just that. It should be person-centered, right? I would say we need to follow what's in the plan, and really the services that you're providing is based on the assessed needs. So not everybody needs that entire, amount. Maybe they need you to come in and get them ready and maybe help them fix breakfast at the beginning of the day. You might then come back, if they need some help in the afternoon, or maybe they have family there in the afternoon, but need help, getting ready for bed and all of that. That is something I would definitely work with the case manager on to see what needs that through their assessment that they need help with. And the person-centered plan of care should be tailored around that.
We have a question from the live YouTube stream. Are all parents who are being paid for caring for their minor children doing so through PDS?
So through our traditional waiver services, so a traditional provider cannot hire an immediate family member to take care of an individual within the waiver program. So if an individual is caring for their children and receiving reimbursement through that, that would be through the participant directed option.
That is all the questions we have at the moment.
Okay, great. So next we're going to talk about the different types of waiver services that are offered in Kentucky. And this is kind of the pathway. How do you want your services delivered to you? So our traditional providers is where participants will use agencies that are certified to provide services to our waivers. And those traditional providers will send somebody into your home to help you and provide those services to you. Our participant directed option, this is where the participants hire their own employees. This could include friends, family, natural support. So they have there is a lot more responsibility with this, right? Hiring, firing employees, keeping up with some additional, the requirements for them, but participant directed services is an option. And then we do have those individuals who choose to have a blended option. So for some of their services, they are using traditional agencies. And then for other services, they are actually hiring their own employees. So next is how to apply for waiver services. I mentioned this earlier about it kind of being a two-step process. And the first part is financial eligibility. You're going to have to apply for that. And then once you get to the end of that application, there is, a button about, needing further services or something like that. And then when you click on that, that is actually going to go in and ask you different questions about your disabilities. And then that is what is then sent to us to review and direct your waiver application to the correct area. So it's kind of like a no wrong door, right? So, it's going to ask, do you have a physical disability? It's going to ask if you have an intellectual disability, if you're on a ventilator. And so depending on how you respond to those questions, is how we will send it through the system to be reviewed. And then on this slide, you can, for the financial eligibility, you can apply by phone. You can do it online, like the Connect. I know I've got a note here to pull some Connect resources to send out. DCBS can help you. You can go to any local office in person as well. Now, one thing is, once you do the financial eligibility piece, DCBS doesn't help with the waiver services, but you can either do that through Connect yourself or our community mental health centers. So down there at the bottom, the CMHCs or our ADRCs, we have links to those of your area, and you can reach out to them and they will assist you in any way possible. Because sometimes I think the systems are a little just a bit overwhelming. So we do have several different options for people. So now that we kind of talked about the waivers, and we're going to kind of go just look at it on the start to the end, just to kind of give you an idea and a perspective of how this works. So you're going to have an application through Connect. And then once you apply for that financial eligibility and you complete the waiver piece, then that waiver application is going to be reviewed. And it depends on what waivers that you meet for. And this is going to be just some high-level criteria, making sure that you have the disability that you say that you have. And just because you have a disability doesn't mean that you automatically are going to meet nursing facility or intermediate care facility level of care. There are some people that might have a disability diagnosis, but are very high-level functioning and do not need services that would qualify through a nursing facility. But let's say that, we had a slot open and there was no waiting list, then you would get that slot. If there is a waiting list for that particular waiver, then you would go on the waiting list. But when you do receive that slot, the next step in the process is an assessment is conducted.
Once her house until she gets there real quick, because she can't help yet.
Once the assessment is conducted and you meet level of care, then that is when you are going to work on finding a case manager. The case manager is going to assist you and is going to look at your assessment to help create that person-centered service plan. And then once that person-centered service plan is created, so that's going to be like finding if you want traditional providers or if you want to participant direct and hire your own caregivers. And once all that is set in place, that is when services are going to begin. Now, each year, the waivers do require a yearly reassessment for level of care and also financial eligibility recertification as well.
Alicia, we have a question from from David. As far as financial eligibility, am I assuming that the individual can use a QIT?
There are some the qualified trust, income trust that I do know that that's out there. I am definitely not the subject matter expert to speak on that because that kind of goes to the financial eligibility side. But that is something, if you want to send me, that we can also get back out to the group as well.
We have a question, and the question is, what would be the best guidance for individuals who are waitlisted?
We do have on our website, there are, we have a list of different community organizations that you can reach out to. Obviously work, if they're school-age children, work through the school supports that, is out there. And so we can definitely share, I'll show you all later on our website to where you can look for our community resources as well.
We have a question from Mary. I have been told that the home and community-based waiver PDS is only attendant care, and the only places you can go are pharmacies, doctors, or shopping for food. Cannot be added to the plan.
So
Also-
attendant care, oh, I'm
Yeah.
sorry.
Are there agencies that can do PDS for home and community-based waivers now?
So if it's an agency, then that wouldn't be participant directed. That would be traditional services, and any services that are put on a plan of care needs to ensure that is meeting the waiver definitions that are within the regulation supporting the waiver that you are referring to.
We have a question from Dynell. If you could improve just one part of the waiver process for individuals and their families, what would it be and why?
One process.
Just one part. If you could improve just one part of the waiver process.
One part of it.
Yeah.
It definitely would be the length of getting services. I do not want any child left behind that is in need of services. And I think this is a good segue to kind of talk about an initiative we have going on right now. It is called our Families First initiative. We actually had a meeting with the public. We had, I want to say, around 200 people there a few weeks ago. It was held in Frankfurt, and this is where we are looking to get children services early on, because we do understand that there are large waiting lists. Each of our waiting lists, just to let you know, we have to have legislative funding to get additional slots for our waivers. But with this Families First initiative, we're looking at children in ways that we can get children the necessary services to help them. I always say early intervention is key. But I'm super excited that this is kind of taking off, and that more information is going to be shared soon. I know they're going to be having roundtables, and if you sign up for our listservs, you will get information about that. And so I would definitely tell everybody, please be involved in this new initiative, so that we can work on, I want everybody to have services, right? But knowing that our wait lists are long and that usually children are put on there at a young age, it will be nice to hopefully be able to get them enrolled and get them with the services that they need at that young age.
We do have a question just related to related to your update. Any updates regarding having more slots available for the home and community-based waiver?
Beginning July 1st of 2025, so here just in a few months, we will have 500 additional slots for the home and community-based waiver. We did have slots, and I don't have them all memorized. I believe, don't hold me to this, that it's going to be 500 in HCB, 500 in Michelle P, 250 in SCL, and 25 additional slots in ABI long-term care. But those will be available starting on July 1st of this year. We will not be able to put all them out on day one, right? We are working through a plan to be approved by the Secretary of the Cabinet, because we don't want to create any bottleneck effects with our providers and with the participants. So we plan to, put a certain amount of slots out each month until those are actually all utilized. But we do have some additional slots. And what I would tell you is, every 2 years is the budget year and the budget cycle that the legislators go through. And I would tell you to go and advocate to all of your legislators that we need more funding for waivers. We need those additional slots to get services to those that need it.
We have a question from Elena. If someone has Title II disability benefits and their cash benefits get paused due to income, from what I've learned, the person is not considered to still be eligible for the waiver due to the definition of disability for Title II benefits being referenced in the eligibility for receiving waiver services. Is medical review their only option to continuing to receive a waiver?
That is not something that I can speak on. I do know that there are times that people do have to go through if they're within the income guidelines, the Social Security income guidelines, then they have to apply for Social Security. And there are other times that there is that MRT review that is completed, but that is all done through our eligibility division. And not the long-term services and supports division.
We also have a question from Aaron. Does any waiver cover childcare services when none is offered for your special needs child?
Repeat that one again.
Does any waiver cover childcare services when there is not anything offered for a special needs child?
So we don't have specific childcare as a waiver service.
This question is from Pam. Can you explain participant directed services in CA?
Participant directed services in CA, maybe they could explain that just a little bit further. And I don't know if they're talking about community access. Again, you know, each of our waivers are a little bit different, right? We're trying to standardize those where we can, but it needs to ensure any service that is put on a person-centered service plan must meet what you're doing within that service, must meet regulatory criteria within our regulations and waiver applications.
CA Pam was referring to community access.
Community access. Okay. Just wanting to make sure because community access isn't available in all of our waivers.
This question is from Patty. Will the children's waiver be 1950C 1115 or something else?
Thanks. Okay. So 1915. So we have, so there's 1915C are the home and community-based waivers, but there's also 1915Is, there's an 1115. None of those decisions have been made yet. So we just had our initial kickoff with the Secretary of the Cabinet and then our commissioners within the Department for Behavioral Health, Department for Medicaid Services, and I think Department maybe of Juvenile Justice was there. So we had a lot of people because we're looking at this from all angles, right? So none of those decisions have been made at this point in time, but definitely, you know, I would encourage you to definitely get involved in this initiative. And further information will be coming out as well.
This question is from Janet. Should our clients apply for Medicaid with DCBS first or get their assessment for waiver completed first?
So you have to apply for financial eligibility first. It doesn't mean that you have to have financial eligibility, but you have to apply. And then once you get your slot, that is when you get your waiver assessment, that level of care assessment. And then for long-term Medicaid, there is a period in which it's pended for 30 days. Before that takes effect. You have to meet that long-term care Medicaid piece. for that amount of time. But you're going to apply for financial eligibility. That's going to allow you to then complete those waiver questions. And then, of course, if there is no waiting list, you will get the slot, and then the slot, you'll have your assessment done. And then the piece kind of wraps back around financial eligibility, because some people have to have waiver in order to be financially eligible.
This question is, does it take a full year? Does it take a year for a full year for a slot to become available after submitting a case closure for a participant?
So if an individual, so I'll use me as an example. If I am on waiver and I use services this year, and say my case is closed because maybe I decide I don't want waiver anymore. Maybe I end up in a nursing facility kind of long-term for a period of time, then that case closure the case will be closed. But because I use those services within the waiver year, that spot is mine. So as long as it's within the waiver year, I have the option to come back out and get that slot back. Now, the one thing that is a little bit different, if someone unfortunately passes away, then that is where we can then turn that slot back into an available status and release that slot to somebody else. But if, say, I just decide I don't want it and I don't come back in within that waiver year to begin services again, then that slot, when the waiver year is up, would go to somebody else. So, it could be, it depends on when you kind of come out of waiver. It might be 6 months. It could be 3 months. It's all based on that waiver year.
This question is from Jessica. If you've been denied Social Security based on income limitations, can the person still receive the Medicaid waiver?
That is not something that I can answer from a policy, long-term services and support side. That is more of a financial eligibility type question.
This question is from Mary. If you want to make changes to the statutes regarding the waivers, who do you contact?
So, and there are a couple of different things. There are Kentucky, there are KRS, which are the statutes, and there's the Kentucky Administrative Regulations, the KARs. And so I think you might be referring to that. And if you are, you can send that information to our public comment box. We are actually working on waiver regulations right now. And when those are completed, to match the waiver applications that were approved by CMS, those all go out for a public comment for at least 30 days. And we, if you're on our listservs, we send that information out. We want everybody to make comments on the regulations, so that we can take that feedback back internally and take a look to see if we have our regulations correct, if we need to possibly make revisions to that. But all the regulations, when they go out for, or when we're reviewing and updating those, they do go out for public comment to everybody.
This question is from David. Any advice or suggestions for autistic children that have been denied by the home and community-based waiver?
So the home and community-based waiver really is for those who are physically disabled or aged. Autism, that is a developmental disability, which is going to be more directed toward our Michelle P. waiver program. And that is why I'm really excited about this Families First initiative, because again, that wait list is long. We all know that. But I see that there's going to be a lot of improvement in being able to get services to our kids. So again, stay involved in that, and please provide us, or provide the department. It's not really, my initiative, but I will definitely be involved where I'm needed. But stay involved, provide that input so that we can really ensure that we're getting services to our children that truly need it.
This question is from Maya. Are there any specific requirements for a family member to qualify as a caregiver?
So there are if you're an immediate family member, there is qualifications, and you have to go through that approval process, which is located in our waiver applications, and the case managers can assist you in doing that as well. And that is reviewed. So participant directed services is the operating agency, is the Department for Aging and Independent Living, and they are the ones that review those requests.
This question is, when participants are waitlisted, does that mean that they have reserved a slot? And if a participant would like to be removed from the waiver waitlist, who would they contact?
So if they're on a wait list, it just means they're waiting until a slot is available. And then once a slot becomes available, it would be given to the next person. I'm assuming we're talking about Michelle P, so I try not to get too specific, because each of our waiver regulations for our waivers, there might be a little bit differing requirements of how slots are released. So our SCL, we have different classes, right? We have an emergency category, we have a urgent category, and then we also have a future planning category. Whereas Michelle P, it's based on, who was put on the list first. That's who's going to be given that slot. So I'm going to go with that, but you're just on the waiting list until you're given the slot, and you're given capacity with information and directions on what to do next. So here is where I will plug in that it's very, very important that you keep all of your information up to date with the Department for Community-Based Services, so that you're ensuring that you get mail that we send out. And then also, if you have Social Security, you have to update your information with Social Security, because Social Security feeds over to our eligibility system, and that's how all of our systems get updated. So really super, super important to make sure that you keep all of your information up to date in the systems. And I think there was a second part of that question, and I totally forgot it. If you want to get off a wait list. So if an individual no longer wants to be on the waiting list, we do send out a letter every year on their date of birth that month. After they've been on the wait list for 365 days. If you want to be taken off the wait list, you can sign that form, check the box, put the information in there, and send it back to the department. But if you already know that you don't need to be on that waiting list, then you can provide the department something in writing with your signature, and then we can remove you from the waiting list if you no longer wish to be on it.
Jennifer asked, how do we find out what number we are on the wait list for the Michelle P waiver?
I'm actually, at the end of my slides, I'm actually going to be sharing some helpful numbers for you all. But for Michelle P waiver, the Department for Behavioral Health is the ones that is the operating agency for the Michelle P and SCL. And we do have their information. There's a phone number and also an email address that you can use either.
This question is, can an individual receiving traditional services transition to participant-directed services, or is there a wait list for participant-directed services?
So an individual has the right to transition. I've heard that sometimes we've had some issues with finding a financial management agency in order to do that PDS payment portion. But if you are wanting to do that and are interested in that, the Department for Aging Independent is the operating agency, and you can definitely give them a call. If the first person you would talk to would be your case manager. And then if your case manager is having any barriers, reach out to Dale to be able to assist with those.
And we have a comment from Carolyn, put information about participant direction on the Division of Long-Term Service and Support website, and then listed the website. It was just a comment. Not,
Did you say that they listed the comment
they,
or listed the website
the
and?
comment from Carolyn was information. They listed a website
Okay.
with information, more information about the Division of Long-Term Services and Supports website.
It might be the one that I'm going to be sharing. So
Yes,
thank you to whoever did that, to Carolyn.
Carolyn. That's all the questions we have at the moment.
All right. Would this be a good stopping point? I do have just a couple other, they're non-waiver related per se. So I think this would be a good transition point if you would like to take that 5-minute break now.
Yes, let's
Okay.
take a 5-minute break and reconvene in 5 minutes, please.
Got 5 siblings, a lot of them have property on the lake, and my parents have property on the lake. So, we wanna like.
Welcome back. Let's see. Welcome back all to the second half of our seminar. I will turn it over to you, Alicia.
Thank you. Can you hear me okay?
Yes, we can.
All right, so we're gonna switch and talk about, oh, hold on just a second. There we go.
We do we do have two questions in the chat. Would this be a
Okay.
good time to ask those questions or?
Yeah, absolutely.
From Patty, is there any resources out there to guide participants who turn 19 on the process they need to go through with SSI and Medicaid?
I have heard internally that they are working on some additional information about how we can let individuals know sooner at the process, but we can take that back and get some information from our financial eligibility staff to share.
This question is, can you apply while currently receiving SSI if you know you will lose SSI in the coming months?
You should be able to go ahead and start that process and apply.
Are there any cases where participants receiving traditional home and community-based waiver services can have their family member as their caregiver until they get approved for participant-directed services?
So the only way that an individual could have their family member working for them is through the participant directed option. Traditional providers in our regulations, they cannot hire those immediate family members to provide those services.
Okay, those are the comments and questions we have now.
All right, thank you. So the next thing that we're going to talk about, we're going to transition just a little bit to something called Kentucky Transitions. And this program really assists individuals leaving a nursing home and returning to the community. So there are some requirements for we call it Money Follows the Person, a program. This is through a grant that we receive, but individuals must be elderly, have a physical disability, a mental illness, an intellectual or developmental disability, or an acquired brain injury. The individual must reside in a nursing facility for at least 60 days or more, and they have to be able to live safely in the community with support and services through the waivers. They have to be eligible for Medicaid and receiving a Medicaid paid service for at least 1 day before referral to this program. And so the Kentucky Transitions, they can provide up to $2,500. This is a one-time supplemental amount that can be used for possible housing security deposit. It could be household setup, utility startup deposits, or even a possible pest eradication. They have transition coordinators within that branch, and these individuals provides, a transition coordinator. They assess the eligibility. They help create that transition plan from the nursing facility to the community. They coordinate all the transition support that the individual will need post-transition. And then they also help complete the transition. So the day of, they are there getting the individual set up in the community when they leave the nursing facility. And then we also have housing specialists within this branch. In the Kentucky Transitions, they provide that housing specialist. They help secure accessible, safe housing in the individual's preferred community setting. So just kind of like, this is kind of, beginning to end. So kind of just that you can see on the screen here, but we start with a referral. That team completes an assessment. There is the transition planning and preparation. Then, of course, we call it the big day, which is the big moving day. And then the post-move waiver services. Some individuals end up not needing services. There are other individuals who do take services within our waivers that we have. It all really depends on the individual, because unfortunately, we do have individuals that go into a nursing facility, which is supposed to be a brief stay, that end up getting, kind of trapped in there, probably a better way to say that. But then they might lose their housing that they have, and they really need help getting back on their feet and getting into the community. So that is another great program that we have here in Kentucky. And then on this slide, we do have our toll-free numbers. We have our email address, where you can view all the Kentucky Transition stuff on our website. And then we also, in the last few years, we have started a program called Program of All-Inclusive Care for the Elderly. The program, and we call that PACE. So that's usually what I refer to it as, but it provides integrated care to aging individuals. PACE is targeted to individuals who need nursing facility level of care, but want to remain in their community and in their homes. When an individual enrolls with a PACE organization, that PACE organization is actually responsible to provide all the care the individual needs, no matter if it's hospital care, if it's that community care, transportation, whatever the individual needs, the PACE program provider is going to be responsible for those services. So individuals, in order for you to qualify for the PACE program, they have to be 55 years or older. They have to meet nursing facility level of care. They have to be able to live safely in the community at the time of enrollment. And then you also have to live in an area covered by a PACE organization. The next, and this is kind of a small chart, so I will apologize. Just not a great way to get this information out there, but I think these slides are going to be sent out, and you can kind of blow it up on your computer so that you can see it if your eyes are old like mine. But we do have several areas that are currently in process. You can see that we do, the ones in red are the ones where providers are still needed. We have the ones in light green, which is a future service area. So this means that they are assigned to a PACE provider. We just don't have the facility up and running and active just yet. And then all the other wonderful colors, they actually, each color goes to a PACE organization. And then we have a contract with the Department for Aging and Independent Living to complete our day-to-day activities. They are the operating agency for this program. We do have information on there. So if an individual says, well, is my county covered? All that information we have out there on our website. Don't hesitate. You can always call or email the pace@ky.gov to inquire if you have questions about that program. And then here are some LTSS resources. So this is online. This is where we have all of our program information, our links to our regulations. We have brochures out there. I'm actually going to share my screen here in just a second and bring that over to kind of show you, and gives you information about who to contact for what types of questions, how to contact us, all that good information. And then our last slide here is going to be who to contact for what. So as you can see, our ABI program, so that's ABI Acute and ABI Long-Term Care, and our Model Waiver 2, the Department for Medicaid Services is the operating agency for those programs. And we have our phone number listed there along with our email address. And then our HCB, or if you have a participant-directed services question for all waivers, that the operating agency for that is going to be the Department for Aging and Independent Living. And then, of course, their number and email address is there. Michelle P. and SCL, the operating agency is the Department for Behavioral Health, Developmental, and Intellectual Disabilities. We have our information also for Kentucky Transitions and PACE. And if you have any other question, we do cover a few other programs here in the state under long-term services and supports that I did not go over today, such as home health, private duty nursing, intermediate care facilities, nursing facilities, hospice. I think I might have covered all of those. But if you have any other questions, you can definitely give that number a call and to ask us. To receive email updates, Medicaid public comment at ky.gov. That is where you're going to want to send an email. And I can put that in the chat here in a few minutes. I don't know that I am smart enough to be able to put it over there while I'm talking. So I will do that just so you all can grab it out of the chat if you want. And then if you're applying for that financial eligibility, who you can contact to do that, or if you're trying to apply for a waiver, the CMHC or the ADRC in your area. And so this kind of ends the presentation part, but I am going to
Alicia, we
yes.
have a couple questions if you
Okay.
want to stop
Yeah.
for those and then
Absolutely.
continue. This question is, how are communication needs such as signing taken into consideration during these various processes?
So I guess I would want a little more information about that. I don't know if they can provide a little more context.
A previous comment is our communication services. Let's see. Our communication services, such as in a respite caregiver, a consideration, such as trying to pair an older deaf person with a caregiver who signs to reduce frustration and loneliness and isolation.
So is the question, I guess, is the caregiver paired with people who that they can meet their needs? Is that the question?
I think that is the question.
So yeah, I mean, definitely we want anybody who's taking care of an individual, they should be trained on that individual, right? They should be able to communicate with them to best meet their needs. And so you would work with your case manager and the agencies that you are using for services.
And the participant, Amy, says, yes, that is the gist of my question. This question is, if you are in a HCSB, can you be in a PACE?
You cannot be in both. So if you are in a home and community-based waiver, you have to do one or the other. You can be in a waiver or you can go to a PACE program, but not in both.
Do all of these applications have to begin in the community? Or can any applications be made from a facility like a WSH?
I wonder if that's Western State Hospital, maybe. No, the applications can be started at any point in time. So that's not a problem. Now, as far as the assessments and stuff like that, then we need to make sure that they're being able to be able to be in the community, and how do we get them there, right? So if there are specific questions on a specific individual, I would encourage you to reach out to the operating agency of whichever waiver that we're referring to here, and really talk with staff so that whether it be me or whoever can assist you through specific case details.
This question is, does the home and community-based waiver also cover those who may be in a facility for a developmental or intellectual disability?
So we don't cover in facilities. So these are all home and community-based waiver programs. But the home and community-based waiver itself is really directed toward those individuals who have physical disabilities or they are of the aged population with needs.
This question is, can you explain the role of a PCA versus an attendant?
So I'm assuming maybe personal assistance versus maybe attendant care. And I don't want to get into specifics on this call just because I think that you need to really look at the regulation. But if you have specific questions based on the waiver that you're referring to, I would ask that you reach out to that operating agency to ask your specific questions. Like I said, we have 6 different waivers. And then sometimes we have it's very similar services, but the definitions might vary slightly. So I'm hesitant to give you any concrete information on that. So I would rather definitely ask your questions to the operating agency based on the waiver that you're referring to.
This question is, can you say again who to contact about our first initiative to possibly participate?
So if you want to, you can, on the screen here, the Medicaid public comment at ky.gov, you can send your information into Kelly Clays. She is kind of one of my right-hand people. She was actually out of the office today, so I didn't have her. She's usually putting stuff in the chat as I'm talking, so I'm kind of doing double duty today. But if you will email that email box, she can get you signed up for our listservs. And then again, any of our social media, please follow those pages because information is going to be, sent out through all those different means.
And this person is also asking a follow-up question. Is there an age requirement?
An age requirement for the Families First initiative?
Yes. Yes.
So really, this is kind of open at this point. I don't know that any definite decisions have been made. So I would definitely make sure that you are involved in that.
This question is, how do we ensure continuity of care during transitions, especially when moving from skilled nursing facilities or psychiatric services into home-based waiver supports?
So through our transitions program, that is something that they help you set up and to complete because yes, a lot of these individuals, they are coming straight from services, in a facility, and then they're going to need to pick up services in the community. So they really help coordinate all of that through our transitions. Kentucky Transitions Money follows the program.
And this question is, in what ways can we better incorporate residential technology supports as part of the transition plan, especially for individuals with limited natural supports?
I would say that as those ideas come up and ideas that you might have for some of our waivers, definitely I think that you should reach out and put those comments to us in the Medicaid public comment box to help us. We want a partnership with you all to come up with unique ways of how we can make sure that people are supported in the community in the least restrictive setting with the services that meet their assessed needs.
And that was the last comment or question we had.
Okay, so I am going to put some information. So can you see my screen that's showing the
Yes.
Division of Long-Term Services and
We can see
Support?
Division of Long-Term Services and Supports.
Okay. Oh no. Now I might have to, I don't see where I can add this information while I'm talking over. Oops, I don't know what let's see.
We are looking at the final PowerPoint slide right now.
Yeah, I don't, whoops, did I do something wrong? Can you still see the
We,
PowerPoint
we
slide?
can still see that. We can still see the PowerPoint.
Okay, well, I will put the links in here. After I quit sharing my screen, what I'll do is I will put the links in the chat. So I obviously can't figure out how to do that at the same time. But this is our main division of long-term services and supports page. We right here on the home and community-based services waiver programs. You can see I go under here a lot because all this is already highlighted. Okay, I was already on that. So we have information. Oh, our program eligibility and service offerings. I won't go through everything here because we could literally spend all day, but we do have the information for all of our waiver programs. Each of these little blocks here, they do expand. And I'm going to put in the chat a couple different things for you all. I'm going to put how to apply for waiver services. So I'll just kind of bring this one up to show you all, but we've got a lot of one-pagers that really help on, here's what you're applying for, and here are the steps that you need to take. So, again, I won't stay on these very long. I will put the links in the chat in just a moment. Another thing is choosing your path to waiver services. And this is kind of some information that whenever I go out and do community engagement, I like to take and provide to the public. But this is like, a little trifold pamphlet that we give out. Just talks about the different service delivery options, who to call, tries to guide you in what waiver might be right for you in your unique situation or your family members. And then, different benefits of our waivers, along with some more utilized Medicaid state plan services as well. And then one of the next big things people always ask about is, who do I call for help with our different waiver programs? Oh, we have a long list. So this is actually the long list. Like if you got Medicaid eligibility questions, it's going to tell you who to call. This document is, I want to say it's 34 pages. So this is the really in-depth one. Let me go back out. And let's see if I picked the right one this time. Okay, let me make this a little bit larger so that everybody can see. So we have kind of some high-level questions and who you would call for those. So whether it be Department for Community-Based Services, here's, to receive email updates about waivers or to make a public comment on a waiver. Here is that email address. Let's see. And then, of course, each of the operating agencies is also on here. And then we also have some documents in Spanish, and I'm going to put that information in here as well. And then let's see, so that's just kind of like an overall more about 1915C HCBS waivers. But this one talks about, this is participant resources. And if you need help finding a community mental health center, the Aging and Disability Resource Center. So, here's a Medicaid member toolkit. If you need help filing a grievance, this is going to tell you how to do that. So lots of information on finding providers, your rights as a participant. And then we do have provider resources as well. So different forms that they're required to fill out, certified provider requirements, final rule settings. So everybody has to meet all the final rules. We have another area, and I won't go into each of these, but different policy guiding, training, and reference materials. So we have, billing and payment, different documents about PDS is listed here as well. And then, of course, like I said, we do have agreements with our sister agencies as the operating agencies for some of our waivers. So we like to put all of their information here. And then the last one is our related websites for additional questions if you have about PACE, transitions, all of that. So I really think that this page right here has a lot of information for everybody. And I definitely think that it's probably underutilized. So, I say use it, share it far and wide. And if you all have questions about things you find on it, please let us know so we can take a look at that. If we need to update something, we definitely can. But this is a very useful website that I am going to share. And so now, in order for me to do that, I'm actually going to stop sharing my screen so that I will be able to put it in the chat for you all. And I apologize that I cannot figure out how to do all of that while sharing
You're
my
doing
screen.
great, Alicia.
Ya, mi amorcito, por favor, déjame un ratito. Hoy día te has puesto.
Okay, I'm actually putting. All right, yeah, so the top one is the main page with the resources. And then, like I said, how to apply, choosing your path to waiver services, who to call, and then the documents that we have in Spanish. So all of you, oh, you know what? I said I put it in there, but it looked like it only went to one person. Okay.
I think if you click on the chat, if you click that arrow, the down arrow, and you click to everybody,
What?
it'll send to all.
Everyone in meeting. Here we go.
Yeah, everyone in meeting.
Control V. Okay.
It worked. Success.
There we go. All right. Do you have any other questions for me?
We have, let's see, I'm going to a comment, and this comment is from Jennifer. This has been so informative. We have another comment from David. Thank you for such a great opportunity for waiver trainings. I enjoy the presentation and your ability to answer so quickly. Becca says, thank you so much for all of the information. If Rhonda asks if someone is on the home and community-based waiver and their name comes up on the Michelle P. waiver waitlist, which one should they choose?
So I will never give my opinion regarding what waiver an individual should go to. What I would say is, what best meets the needs of the participant based on their assessment. So I think that's going to be different for each individual case. I would discuss it with family, with maybe your case manager, but I would never want to tell you, you should go to this waiver or stay in this waiver. As I personally don't think that would be very professional of me for one, but I think it's really based on the individual's needs.
Mm-hmm. And the same question comes from Rhonda. Are there more benefits to one over the other? And referring to the HCB waiver over the Michelle P. waiver.
So what I would say is there are different services offered in the HCB waiver versus maybe what's in Michelle P. waiver. One of those being, or two of those, so supported employment is not going to be in the home and community-based waiver. That waiver is more designed for the aging population and maybe for those that have a physical disability. But our intellectual and developmental disability waivers, they have behavior supports. They have some other things in there that may better meet an individual's needs depending on that person's specific situation. But, I would look at the services offered in each of the waivers.
And Patty in the chat echoes that comment, says, I'd say to research the services each of them offer and make a decision, choose that way. We have another comment says, thank you for the insightful information. This question is, are you aware of any updates on the 1950 ISPA?
I believe, and is Aaron Bickers on here?
I'm on.
Hey, do you have the information about the 1915 I?
I believe it was approved last week.
Okay, that's what I was thinking. Either late March, early April, that the 1915 I was approved.
Do we have any other comments or questions from our participants? Did you like to put in the chat or perhaps unmute and ask your question?
And while we're waiting, I just want to thank everybody for attending today and for listening to me talk for like an hour and 40 minutes. I hope that this was beneficial, useful for you. I hope that you've learned something. And at any point, don't forget that we are here to help, even if we might not know the question right off. We can take it back. We can get internally with other staff, with our sister agencies, but that is what we're here for. And all of us with the Department for Aging and Independent Living, Department for Behavioral Health, and Medicaid, we work together very, very closely. So thank you all so much.
Are there any other questions or comments from our participants? We have a few minutes if you'd like to ask a question or two. We have a comment that says, thank you. I am hopeful that this information can benefit some of our patients to get the community supports they need so they are not left with only the hospital to care for them. This question is from Eileen. Is there a push for getting the kids on the home and community-based waiver off?
No, each waiver, so individuals that are on each waiver should qualify for each waiver, based on the regulatory, criteria. You know, I would say that sometimes, individuals might, like somebody said earlier, get a slot for a different waiver and might choose to go to a new waiver, as long as they meet that criteria. But there's not a push to get, children off. I think what we should be looking at is, what program best meets an individual's needs, whether it's a child, whether it's an older individual, because we want the services tailored to their specific needs and where they're at in their life at that point.
This question is from Grace. Had a family ask if they could have two representatives cite simultaneously with participant-directed services on the Michelle P. waiver?
To be honest, that is not something that I think that I have been asked before. I will take that back to our other assistant director, April, who oversees that contract. Let's see, two PDS reps, right? Is it allowed? I don't want to give you an answer because I'm afraid I'll be wrong, but it seems, if they both understood, I mean, it is a non-paid position and that they were in agreement, but definitely I'll take that one back because I've not been asked that question before.
Any other comments or questions from our participants? You can either put a question in the chat or you can ask your question, unmute and ask your question.
This is Ashley. So technology living. I'm in a program called Technology Living with Dennis Griffin. I don't know if you know him or not, but so the PA and the CA services, that's not included in the technology living waiver.
So I'm wondering if you are receiving possibly I'm not sure without having some additional information, would it be okay? Because I don't want to discuss any specific
Yeah.
cases or because HIPAA and all of that. But what I can do is I will put my email address in the chat. And if you want to pull it out, if you want to send me kind of your information, your question, and I will route it to the appropriate staff to reach out to you and get you the answers that you need. Okay.
Okay.
Okay. And I just put that in the chat for you.
Would you like to come in and talk with the archives? I'm on a Chester board for the Arc of Central Kentucky, which is we have our own little group, and Chris Ryder and Vlad are in charge of that. Would you like to come in and talk with us about these services and stuff?
Yeah, I mean, if you want to send that to me in email and we can try
Okay.
to work something out.
All right. We appreciate it.
Absolutely.
Yeah.
Thank you, Ashley. Appreciate that.
Is there any way we can get a copy of your PowerPoint emailed to?
Absolutely. I will email you a copy of the PowerPoint. I would like to thank our presenter, Alicia Clark, today for taking time out of her day to share experiences and her expertise with us. It's been an informative presentation. Thank you so much, everyone, for their time. Be well.
Thank you for having me.
Thank you. Be well and stay safe, everyone.